So today we will discuss on the topic bisphosphonates, endocrine system. Still, I think in other subjects, anatomy or physiology, I think still there is the renal system is going on, but we have started the endocrine system. Pharmacology department has started the endocrine systems, and only we are covering those topics. Those topics for that the anatomy and the physiology is not that much important. So we will start the important topics. We will start the important topics once the anatomy or the physiology, if they will also start this about the endocrine system. So today we will discuss on the topic biphosphonates. Okay, biphosphonates. Okay, not so important for examination point of. Uh, it is not that much important for examination point of view. Sometimes they may ask the question from the biphosphonates. What will be the question we will discuss at the end of this topic? Okay, so biphosphonates. Okay, so we have already covered this. I think that is about the hormones of the endocrine system, like growth hormone, prolactin, gonadotropin releasing hormone. Leave it. So today we will discuss on the topic biphosphonates. Okay, so what is the biphosphonates? Okay, so they are the chemical compound of the pyrophosphate. They are the chemical compound of the pyrophosphate. That is the phosphorus compound. They contains the phosphorus compound, analogs of the pyrophosphate. Phosphorus compound. They contain the phosphorus compound. Okay, that is not important. Okay, so what are the drugs that comes under the biphosphonates? The drugs that comes under the biphosphonates are the importantly the drug is the alendronate. Clinically used drug is the alendronate and the etidronate. So many drugs are there. 5 or 6 drugs are there. At least remember the name of the 2 drugs, but importantly the alendronate. Alendronate is the most important drug, and the second drug is the etidronate. Second drug important is the etidronate. So at least remember the two drugs name. They are the alendronate and the etidronate, and the other drugs, other biphosphonates are the risdronates and the zoledronic acid. Risdronate and the zoledronic acid. So I will repeat it again. The biphosphonates are the analogs of the pyrophosphate. They are the analogs of the pyrophosphates, and the drugs that comes under the biphosphonate, they are the alendronate, risdronate, etidronate, and the zoledronic acid. Zoledronic acid. One other drug is also there. That is called. One other drug is also there. Palmidronate. That is the palmidronate. Okay. Biphosphonates, they are the analogs of the pyrophosphate, and the drugs that comes under the biphosphonates are the alendronate, risdronate, etidronate, and the zoledronic acid. So most importantly, you have to remember the 2 names of the drugs. They are the alendronate and the etidronate. And if you have to remember only one drug, that should be the alendronate. That should be the alendronate. Okay. Routes of administration of the biphosphonates. The routes of the administration of the biphosphonates, they can be given either by the oral administration or by parenteral route. In parenteral route, intravenous route. So oral drugs, alendronate and the risdronate. Alendronate and the risdronate. Oral drugs are the alendronate and the. So route of administration of the alendronate, they are the oral administration. The drugs that can be given by the oral administration are the alendronate and the risdronate, and the intravenous route of administration, zoledronic acid. Okay, route of administration. So alendronate, they are the analogs of the pyrophosphates, and the drugs that comes under the alendronate are the biphosphonates are the alendronate, etidronate, zoledronic acid, and the risdronate. The most important drugs are the alendronate and the etidronate. The route of administration, oral route of administration, and the intravenous route of administration. Oral drugs are the alendronate and the risdronate, whereas the intravenous route, the drugs that can be given by biphosphonates, which are given by the intravenous route, are the zoledronic acid. Zoledronic. Pharmacokinetics of the biphosphonates. The oral biphosphonates, their absorption is significantly interfered by the food. Oral biphosphonates, their absorption is significantly interfered by the food. That is the reason this drug should be given probably half an hour before the food in empty stomach. We can say the empty stomach. Okay, oral biphosphonates, their absorption is significantly interfered by the food. That is the reason this drug should be given in the empty stomach, 50 to 20 minutes, or we can say half an hour before before taking the meal. Okay, and they are rapidly clear once they are absorbed into the circulation. Oral drug, when they are absorbed into the circulation, or when the drugs are given by the intravenous route at the zoledronic acid, they are rapidly cleared from the plasma, because these drugs, these drugs, they are bound to the hydroxapeptide minerals of the bone. So hydroxapeptide is the mineral that is present in the bone. hydroxapatite is the mineral that is present in the bone. That is that is composed of, I think, hydrogen, oxygen, and the phosphorus. That is composed of the hydrogen, oxygen, and the calcium. Hydrogen, oxygen, and the calcium that is present in the bone. And the function of the hydroxapatite, this mineral is it is used for the building up of the tissues of the bone. Okay, so this mineral is present in the hydroxapatite mineral is present in the bone. And when this this biphosphonate, oral biphosphonate, they are absorbed, or when the intravenous biphosphonate they enters into the circulation directly, they rapidly bound to the hydroxapatite minerals of the bone. That is the reason they are rapidly cleared from the plasma. Okay, and the elimination of this drug is primarily through the kidney. Primarily through the kidney. That is the pharmacokinetics. I will repeat it again. The pharmacokinetics. Oral biphosphonates, their absorption is significantly interfered with the food. That is the reason this drug should be given before in the empty stomach, half an hour before the meal. And these biphosphonates, they are rapidly cleared from the plasma, because once they enters into the circulation after absorption or directly into the circulation when they are given by the intravenous route, they bound to the hydroxapatite mineral of the bone. Okay, and the elimination primarily through the kidney. That is the pharmacokinetic of the biphosphonates. Now the mechanism of action of the biphosphonates. So mechanism of action of the, so we know the bone resorption. What is the bone resorption? First of all, we have to understand the bone resorption. So we have already discussed about the bone resorption in the previous lecture. So what is the bone resorption? Bone resorption means that is the flux of the calcium. Calcium is released because of the osteoclastic activity. So we know that what is the osteoclastic activity? What are the osteoclasts and the osteoblasts? You know about it. What are the osteoclasts? Osteoclasts are those cells of the bone. They are the cells of the bone. Which are responsible for the destruction of the tissues or the cells of the bone. Whereas the osteoblast is the bone forming cells. Osteoblasts are the bone forming cells. So what happened when the osteoclastic activity is increased? When the osteoclastic activity is increased, that is the activity of the bone destroying cells are increased. They increases the bone resorption. So what is the bone resorption? Bone resorption is the release of the calcium or the flux of the calcium from the from the bone into the surrounding circulatory system of the bone. So the calcium enters into the circulation. That's called the bone resorption. So what is the mechanism of action of the biphosphonates? So biphosphonates, they reduces the bone resorption. So what is the mechanism for the inhibition of the bone resorption? The mechanism for the inhibition of the bone resorption is the number one is the decrease in the osteoclastic activation, decrease in the osteoclastic formation or the activation. That means these biphosphonates, they reduces the osteoclast formation. That means the osteoclastic activity is reduced. So when the osteoclastic activity will be reduced, what will happen? Bone resorption will be reduced. So when the bone resorption will be reduced, what will happen? They reduces the flux of the calcium from the bone into the circulation. Okay, and the second mechanism is the probable mechanism is the increases the osteoclastic apoptosis. What is the apoptosis? Apoptosis means the programmed cell death. That means there's automatically the osteoclast cells, they will be automatically died. So what will happen when the osteoclastic cells will be died? What will happen? Osteoclastic activity will be reduced. So when the osteoclastic activity will be reduced, there will be the inhibition of the bone resorption. Okay, and however, and the third thing is that the only impaired osteoclastic activity is inhibited, while the osteoblastic activity is not inhibited. Okay, so osteoblastic bone formation cells will remain intact, whereas the osteoclast bone destroying cells will be inhibited. So this is the mechanism of mechanism of the biphosphonates. So I will repeat it again, the mechanism of the biphosphonates. So they reduces the osteoclastic activity. So biphosphonates, they reduces the osteoclastic activity. Number one, so they increases the osteoclastic apoptosis. That means the osteoclast cells are destroyed automatically. That's called the apoptosis, programmed cell death. So because of reduction, so overall effect will be the inhibition of the osteoclastic activity. So when the osteoclastic activity will be reduced, what will happen? Bone resorption will be inhibited. So when the bone resorption will be inhibited, there will be the inhibition of the flux of the calcium from the bone into the circulation. So this is the mechanism of action of the biphosphonates. Okay. So again, same. I have already discussed. Already discussed earlier that the decrease the osteoclastic bone resorption that results in the decreases the osteoclastic bone resorption that results in the small but significant net gain in the bone mass. If the osteoclastic activity will be reduced, that will inhibit the bone resorption. When the bone resorption will be inhibited, the overall effect will be the net gain in the bone mass. Net gain in the bone mass. So we can say that where the biphosphonates are used. So biphosphonates are used in those diseases that are associated with the reduced density of the bone, like osteoporosis, Okay. So one of the indication of the biphosphonate is the osteoporosis because they inhibited the bone resorption. So that means they increases the density of the bone mass. They increases the density of the bone. Okay. Now indications. Okay, indications. So number one indication is the disorder of the bone remodeling. Okay. So what is the disorder of the bone? So okay. So remodeling one, it's a bone forming process. It's called the remodeling. Okay. So what are the indications of the biphosphonates? Osteoporosis. Number one is the osteoporosis. So what is osteoporosis? We have already discussed in previous lecture. It is a disease of the bone that is associated, that is characterized by the reduced quality and the density of the bone. So that makes the bone fragile. So makes the bone fragile, and that results the bone fracture. The reasons for the osteoporosis are the number one is the deficiency of the calcium from the diet. Okay, and the second is the postmenopausal osteoporosis. That is the osteoporosis that happens in women during the postmenopause phase. After the 45 years of the age in the woman, and during which the menstrual cycle is completely stopped. That's called the postmenopausal phase. So during the postmenopausal, what will happen? There will be the reduction in the secretion of the estrogen that results the postmenopausal osteoporosis. So in these indications what are the indications? So number one is the osteoporosis. And similarly, they are also used for the prevention in the treatment of the postmenopausal osteoporosis. Okay. And the other disease is the Paget's disease and the hypercalcemia in the malignancy. Okay, Paget's disease. So Paget's disease, it is the genetic disorder of the bone that is associated with the, what happens in the Paget's disease? There will be the increase the pathophysiology of the Paget's disease that increases the osteoclastic activity, so bone resorption. So that results in the hypercalcemia. Okay. So what is so we can use the role of the biphosphonate here is the reduces the osteoclastic activity. So they reduces the calcium level they reduces the calcium level in the plasma. So that treats the Paget's disease, hypercalcemia, because of the Paget's disease. And the other indication other than the bone disorder is the malignancies that are associated with the hypercalcium. So we know that what is the hypercalcemia? Hypercalcemia is the excessive level of the calcium in the plasma or in the serum. When the serum plasma level is more than 10.5 milligram per deciliter, that is called the hypercalcemia. So what is the role of the role of the biphosphonate here is they inhibit the flux of the calcium, they inhibit the bone resorption, so they inhibit the flux of the calcium from the bone into the circulation. So they inhibit the level of they reduces the level of the calcium which are present during the hypercalcemia in the blood. That's called hypercalcemia of the malignancy. So I will repeat it again. What are the indications of this biphosphonate? Number one is the osteoporosis. Okay. and the similarly the prevention and treatment of the postmenopausal osteoporosis. Package disease, this is the disease of the bone that is associated with that is characterized by the hypercalcemia. So to reduce the hypercalcemia, and also this package disease, it makes the bone fragile. It makes the bone fragile. So for the treatment of the fragile bone or for the treatment of the hypercalcemia and the package disease, biphosphonate is the useful. Okay, and the hypercalcemia of the malignancy, to reduce the calcium level, increase calcium level that's present during the malignancy by inhibiting the osteoclastic bone resorption. So these are the indications of the biphosphonate. These are the indications of the biphosphonate. Now the adverse drug reactions. So basically with the oral drugs, they produces the GIT disturbances. So what are the GIT disturbances? Like the abdominal pain and the diarrhea. These are the abdominal pain and the diarrhea. These are the GIT disturbances. So when the alendronate is other problem with the alendronate is the it may cause the oesophagitis and the oesophageal ulcer. That means the inflammation of the infection of the esophagus, and the ulcer, production of the formation of the ulcer in the mucosa of the oesophagus. So to minimize that, this oesophageal irritation, patient should remain upright for at least 30 minutes after taking the biphosphonate. The reason for that, all the biphosphonate will be by remaining in the upright position. The biphosphonate taking along with the water will be entered into the stomach. So all the particles will be entered into the stomach. So that will produce that will minimize the esophageal irritation. So I will repeat it again. Adverse drug reaction. Number one, they produces oral with the oral administration. Adverse drug reaction with the oral administration are the diarrhea, GIT disturbance. They are the diarrhea, abdominal pain, and with the alendronate, they cause the oesophageal irritations. They are the oesophagitis and the oesophageal ulcer, mucosa inflammation of the mucosa of the oesophagus, and the inflammation of the and formation of the ulcer in the esophagus. So to minimize the oesophageal irritation, patients should remain in the upright for at least 30 minutes after taking the biphosphonate. The reason is all the biphosphonate particles will be flushed flushes, or we can say will be entered into the stomach rather than remaining in the esophagus mucosa. So that reduces the esophageal irritations. These are the adverse drug reactions of the biphosphonates. Okay, I think everything is simple here. Nothing complication. No complicated. Nothing is difficult here. So should I continue? Last slide for today. Contraindications, renal impairment. So we know that these drugs they are taken with they are primarily excreted into the kidney, through the kidney. So that is the reason the patient with the kidney disease, the patient with the renal failure, or the patient with the reduced renal function. So so what will happen? Those patients, the biphosphonates are taken, the excretion will be reduced. The excretion of the drugs will be reduced. So the biphosphonate will remain in the body. They may produce the toxicity. So this is all about the biphosphonate. So what is the important? So what we will summarize. We will summarize this topic again in brief. So biphosphonates. What are the biphosphonates? They are the pyrophosphate analogs. Number one thing. Okay. Number two, what are the drugs? Alendronate and the etidronate. At least remember the two drugs. They are the alendronate and the etidronate. Oral drug, most of the drugs they are given by the oral drug, they are the alendronate and the etidronate, and even the risdronate or the palmidronate, and the zoledronic acid, that is given by the parenteral route. Okay. And oral biphosphonate, their absorption is impaired. The absorption of the oral biphosphonate is impaired while taking with the meal. So they should be given in the empty stomach, and primarily they are excreted by the kidney. Mechanism of action: inhibit the osteoclastic bone resorption. So they maintain the density of the bone. Okay, and the indications: bone disorder like the osteoporosis and the postmenopausal osteoporosis, and in the malignancy where the hypercalcemia is there, and the package disease, and adverse drug reaction: GIT disturbances like diarrhea, abdominal pain, and the possibly with the alendronate that produces the esophageal irritation, infection, inflammation of the esophagus, and the inflammation of the esophagus and esophageal ulcer formation. So to minimize that, the patient should remain in upright position for 30 minutes after taking the alendronate, and the adverse drug and the contraindication in the renal impairment. So basically, they may ask the question. So where the question will come from the biphosphonate. Most importantly, in practical, in spotters, they will keep the spotters. Their biphosphonate, we will keep their spotters. That's a biphosphonate. The indication, the question will be the identify the drug that is a biphosphonate, and their indications: osteoporosis, Paget's disease, at least remember 2 diseases, and what are their adverse drug reactions: esophageal irritation, esophageal ulcer formation. These are the important things. Or a multiple choice question, they may ask the indications, okay, or they may ask the mechanism of action in brief. So the answer will be the inhibition of the osteoclastic bone resorption. Okay. So that's all for today.